Last week, public hearings were announced after Mercyhealth's decision to shut down inpatient mental health treatment services at its Rockford campus. Tonight, community leaders came together to share their objections. 9th Ward Alderman Bill Rose shared a letter during tonight's Rockford City Council meeting. It's written and signed by a handful of city and county leaders. The letter also makes the case for the Illinois Health Facilities and Services Board to deny Mercy's request by refuting claims made by the hospital. Mercy's pointed to a lack of patients and not enough doctors. Rose says everyone's working together to keep the services available on the west side.
Our community is working across party lines and working across government agencies to ensure that these mental health services are supposed to stay here.
Alderman Rose will share the full letter at Thursday's public hearing that's set for 2 p.m. at the Nordloff Center. Mercy's decision's been met with concern by mental health advocacy groups as well. Alexis Carpello spoke with one of those groups today, and they tell Alexis more mental health resources are needed in the Rockford community, not less.
Research shows that to provide minimally adequate service to individuals with acute mental illness, we would require 50 beds per 100,000 people.
As Mercyhealth shuts down its mental health unit, NAMI Executive Director Danielle Angelari shares it couldn't have come at a worse time.
We are very much against the decision to close the mental health unit at Mercyhealth. That would leave us with about 20 adult beds and 12 adolescent beds at Swedish American. I believe that we need more resources, not fewer, especially in a time of a worldwide pandemic. Mental health needs are on the rise, and it's not a time to take support away.
She says closing the mental health unit on the west side of Rockford is detrimental to the community.
We're going to continue to send people outside of our community for help, which can be traumatizing to people, not just children, but adults too. So an ICU for someone in heart failure is similar to the psychiatric unit for someone living with a serious, chronic, lifelong mental illness. And you can't predict when someone's going to become symptomatic or get sick. So, there needs to be something in place for those people.
According to a letter signed by leaders across the community, police respond to at least 2 calls per day relating to mental health emergencies. Winnebago County Board member Angie Gorel was one of the 15 signatures.
So I'm very disappointed in them. They came here with a promise.
Reporting in Winnebago County for your home team, I'm Alexis Carpello.